Great. Hello, everyone. Thank you very much for being here. I'm here representing the Interact team. So the other principal investigators on the project are Dr. Megan Winters at Simon Fraser University and Dr. Jan Kestens at Université de Montréal. I'd like to acknowledge our shared connection to the land and recognize that the Indigenous peoples on Treaty 6 territory and all Indigenous peoples have been and continue to be stewards for social justice, equity, and land-based education. In the spirit of reconciliation, may we all strive to learn and support the work of Indigenous communities as allies and return their lands. In the background there, you see a photo of Louis Riel on the banks of the South Saskatchewan River. This photo is meaningful to me because my mom grew up about 20 kilometers away from there in a small town called St. Louis. So I spent a lot of my childhood playing on the banks of that river, where not that long ago, Louis Riel and other Métis leaders were in a rebellion against English Canada. And I recognize as well that many people are joining from all kinds of different places all over Canada. And if you feel the need, you can post your land acknowledgement or recognition or reflection in the chat. So I'm going to be polling you a little bit today. We're going to have 2 sessions on Menti. So if you go to menti.com and use the code 6615743, tell me, why are you interested in healthy built environments? What makes you tick? Why are you interested in doing these kinds of things, doing this kind of work? I'm interested to know from the people here, why are you interested? What are you interested in? You could also scan the QR code on the bottom there, and we'll wait for some responses to come in. Good, because marginalized people continue to get screwed over. It affects us all. Better place to leave my kids. Chronic disease prevention, creating living and working environments that improve people's health. It's an issue of inequity, better overall health, more just society, sustainability. Great. It's an upstream approach that to improve health for everyone, a better place for the next generation. Addressing inequities, better health. Part of my work to support local government. Great. Individual health is impacted by so many factors. You need to acknowledge and bridge gaps and improve holistic health. An area that has the potential to make a big positive difference in all our lives. When you build healthy options, when you have healthy options built into your environment, you're more able to, more likely and better able to access them. Helps in changing climate change again, increased longevity of communities. Awesome. Thank you so much, everyone, for participating. Oh yeah, I forgot. Si vous avez des questions en français, si vous voulez interagir en français, me poser des questions en français, vous êtes les bienvenus dans soit le chat ou ici, indispensable pour vivre vieux, actif et en santé, indispensable for living to a healthy, active, and older age. So thank you very much, everyone. I really appreciate your participation. So what we know is that investments in sustainable transportation have the potential to boost health and equity. I don't think I need to tell you that. But also that the Canadian government is promising quite a lot of money over the next number of years for both active transportation and public transportation. There's a $400 million active transportation infrastructure plan and a $14.9 billion public transit plan. And what we're interested in with our Interact project is what will the impact of these investments be on population health and on health equity. So Interact is a partnership, a research partnership with cities and communities. We harness big data to deliver timely public health intelligence on the influence of real-world built environment interventions on health, well-being, and equity, generating local evidence and action to advance the design of smart, sustainable, and healthier cities for all. Interact is a research project that's in 4 cities. We have a cohort study of over 3,000 people who've participated. We have over 50 local partners. We've had 34 trainees. We have 22 papers. We have 5 offshoot research projects and 1 national knowledge hub. And I'll be sort of speaking to all of these in the next few days. You can visit our website at teaminteract.ca. So Interact is 4 studies in 4 cities. We're interested in understanding the impact of 4 different urban environmental interventions in 4 different cities. In Victoria, BC, we're studying the All Ages and Abilities Cycling Network. In Vancouver, we're studying City Greenways. In Saskatoon, we're studying the Bus Rapid Transit Plan. And in Montreal, we're studying the Réseau Express Vélo. Our 4 research objectives. Our first research objective is to understand context of urban interventions. Second, to measure change in urban form and in population health. 3, to analyze impact of interventions on health, well-being, and inequalities. And 4, to mobilize knowledge to guide future decision-making. So when we were preparing this presentation, we kind of thought, well, what would you be interested in? How might we discuss sort of what we've done and what we've been working on over the past number of years? So Interact started in 2016, and we've been kind of going ever since on that. So we're going to present to you, or I'm going to present to you sort of 3 aspects of our work. Each of these is represented in a to be published or published report or paper. And we're going to talk about policy, we're going to talk about recruiting participants, and we're going to talk about physical activity in 3 sort of sections of this talk. So the first question we have asked ourselves, and we've been working on a bunch of aspects related to this, are how are health and equity considered in the policy documents guiding the implementation of sustainable transportation interventions? So when we think about designing cities or building cities for health and equity, if health and equity are or are not in these policy documents or in these guiding documents or large vision documents for cities, that's going to potentially impact how cities actually can and do think about health and equity. Second, we're going to talk about recruitment. So we've recruited a cohort of over 3,000 people in 4 different cities, and we've done some research on what are the most effective ways to recruit and retain cohorts for population health research. And last, we're going to talk about physical activity. Like I talked about at the beginning, we harness the power of big data. So I'm going to talk about a large physical activity study that we've done looking at how urban environments influence physical activity. So if we talk about policy, we know that the impact of built environment interventions depends on the policy context. Different cities have different political environments, different weather environments, different provincial political environments that are all going to potentially impact how they're able to deliver or not deliver healthy and equitable cities. So what we wanted to do with this work was to look at our 4 cities and do 2 things. First, we wanted to do a document review. So we went to key policy documents in each of our 4 cities. So in Victoria, our primary policy document was Go Victoria. In Vancouver, it was the Greenways Plan. In Saskatoon, it's the Corridor Transformation Plan. And in Montreal, it's the Montreal Ville Cyclable Plan. And we reviewed those documents for key things like talking about health, any mention of health, any mention of equity, mentions of wellness, mentions of climate change and other kinds of things. And then we went to our local policymakers and advocacy groups in each city, and we talked to them about how they are or are not integrating health and equity into their work. So in Victoria, we spoke to people who are in the planning and delivery of programs. These are people like traffic engineers, public transit engineers. We talked to communications and engagement people with the City of Victoria and with advocacy groups. In Vancouver, we talked to planning and delivery folks. In Saskatoon, we talked to planning and delivery, comms, and city councillors. And in Montreal, we talked to people who do planning and delivery and city councillors. And this report will be released soon, and I'll speak to the results a little bit here. So how is health considered? Broadly speaking, when we look at high-level policy documents and we talk to people on the ground in cities thinking about health, broadly, health is thought of as something that cities should be doing, but it's a high-level goal, and it's often sort of articulated in terms of safety and personal security, and I'll speak to that in a second. So from the Vancouver Transportation 2040 plan, we envision healthy citizens in a safe, accessible, and vibrant city. Our goals to support this social vision are facilitate and encourage active lifestyles and support vibrant public spaces that encourage a culture of walking, cycling, and social interaction. In Victoria, from Go Victoria, our job is to make healthy, sustainable, and accessible transportation choices easy through simple, practical, and affordable solutions. There's a lot of discussion in these safety plans and the other policy documents about Vision Zero, and traffic fatalities, so safety and personal security. You can see the quotes there. That's something that's seems to be come out as a key health indicator for cities. Now, when we talk to city staff, we get a little bit of a different story. Planners also viewed health through safety and accessibility, but they saw it sort of as a secondary outcome. So in Saskatoon, health is something that is more tangential to what our express mandate is. We all have a kind of built-in or learned through our planning education purpose to build healthy, vibrant, happy communities. In Vancouver, if we made it safe and accessible, then the physical and social benefits, health benefits would flow from that. But if we don't make it accessible and we don't make it safe, then we couldn't fulfill those other objectives. So that's how health is sort of considered when we look at policy documents and speak to policymakers in our 4 cities. Now, when it comes to equity, equity is something that's much more rarely considered in our policy document and discussions with our city partners. So in the policy documents we reviewed, only 3 of them defined equity. Only 4 of them had actions targeting specific populations, equity-seeking groups, and 0 of the plans referred to equity principles on selecting locations of interventions or any other criteria for where and how equity or inequities might actually be reduced. So when we look at equity, none of the policy documents use terms like recognitional, procedural, distributional equity. And few had sort of any definition at all of equity. Victoria is one exception. So in Victoria, they define equity as treating everyone fairly by acknowledging their unique situation and addressing systemic barriers. The aim of equity is to ensure that everyone has access to equal benefits and outcomes, whether through participation in project and policy planning initiatives or the use of city investments in infrastructure and services. When we look at actions targeting specific populations, most of the plans in Victoria, Vancouver, Saskatoon, and Montreal focused on universal design and accessibility. Things like all ages and abilities, all ages and incomes and abilities were key focuses of plans and equity. So for example, in Saskatoon, supporting universal accessibility, everyone is a pedestrian during part or all of their journey. As such, the design of sidewalks, crossing, and connections with private properties can create barriers for people with physical and or cognitive disabilities. Universal accessibility is essential to support not only people with mobility challenges, but will make public space comfortable for everyone. And policies varied quite a lot on how they were going to actually address equity in their work. So in Victoria, they said they should focus on improvements in areas with the greatest need. In Saskatoon, related to transit, they're looking for the largest potential market for transit and trying to ensure that the ridership sees a sufficient amount of service. So in our review of policy documents in general, there was a limited focus on equity, both in terms of definition and also specific actions that cities would take. When we spoke to city staff about equity, it was key that equity was an increasing area of focus for staff. And it was something that they were thinking about, but something that they sort of had a hard time operationalizing. So in Vancouver, one of the quotes, I think traditionally we've been trying to provide facilities to kind of manage growth and development patterns, but I think increasingly we're recognizing that more equitable provision elsewhere is just as important. And different cities take different approaches. In Victoria, spatial equity was a key consideration. So where the AAA cycling network was placed in space in the city was really important. And BRT in Saskatoon, the bus rapid transit system, was really sort of focused on equity in terms of being able to use the bus, things like translation services, access, and less concerned with things like spatial equity in terms of focusing on priority populations where the buses were going to go. So our high-level summary slide, in terms of our equity, health and equity in policy briefs. First, safety and accessibility are key for achieving health and equity. That's how cities tended to conceptualize health and equity, was this focus on safety and accessibility. Our own work and our discussions with the city show that equity policy is a fast-moving area and that cities are really thinking about this and really challenged by trying to operationalize and define how they're going to approach equity. Saskatoon, for example, has adopted a triple bottom line approach that's basically talks about economic, climate, or sustainability and equity considerations in their work. The challenge with that approach is how do you actually operationalize it as a transit planner or a traffic engineer? And third, city staff have questions around balancing needs from different groups and operationalizing equity, as I spoke to a second ago. So what's next for this work for Interact? We're developing what we call PIST, Practices and Inspiration for Sustainable Transportation Equity. So this is sort of a spin-off project of our work. And really, the report will be released in the coming weeks. And really, this is a document that highlights and reviews, presents some of the work that I've just presented to you today, but also highlights cities that are, we think, the leaders in equity in Canada and the work that they're doing and how other cities can take inspiration from these equity leaders in sustainable transportation in Canada. Okay, second thing I want to speak to you about is recruitment. So how do we recruit and retain large cohorts for population health intervention research or for research in general? One of the things we realized very quickly in our Interact project was it's really hard to get a sense of how to recruit people, how much it's going to cost, and how to recruit different equity deserving populations in different cities. Each city kind of has its own context, its own population distributions, its own kind of things that it has that are unique about it. And we really struggled to try to find information on how to go about doing that. So when we started the study, we did a whole bunch of things, like I'm sure many of you have, to try to recruit people. But we also did include a sort of systematic or semi-systematic study about how sorry, I'm just seeing the chat here, how cities were recruited. So there's a question here, why is Greenways Plan in Vancouver the primary document to focus on when it's almost 30 years old? Anita, yes, we also included other documents, but the Greenways Plan was the one that our Vancouver partners and stakeholders suggested we should use, as it's the sort of key document. What criteria was derived at the 4 cities included in the study? Thanks, Jacqueline. So we have in the study, we have Victoria, Vancouver, Saskatoon, and Montreal. And really we included the 4 cities in the study because at the time we were planning the funding in 2015, 2016, we were really looking at cities that were going to have sort of an imminent, large scale built environment change. So we were really interested in having a cohort study and then having some pre-measurement data, having a city have a large scale change like the AAA network in Victoria or the bus rapid transit in Saskatoon, and then to be able to follow up post-intervention. So the idea of a natural experiment study where we can collect pre-data, we have a city that's going to have a large-scale built environment change, and then we can follow those cities over time. So that's why we have Victoria, Vancouver, Saskatoon, and Montreal as cities included in Interact. And I will keep the chat open so I can monitor that. Okay, so when we're thinking about data on recruitment and effectiveness, it's really lacking. It's really hard to find. If you've done studies like this, it's sort of a challenge to figure out. So what we did with Interact was we used a whole host of methods for participant recruitment, and we were able to analyze how participants were recruited and what methods were more effective or less effective and how much those different methods cost. So I'll just orient you to the figure here. So what you see on the x-axis is the different cities. So Montreal, Saskatoon, and Vancouver. We don't have Victoria in this because we hadn't started. Oops, go back. So we hadn't started that yet. Oops, I went way forward. There we go. And on the y-axis, you have how participants heard of the study. So this is asking participants, how did you hear about this study when you were recruited to the study? The size, so this is called a mosaic plot. So the size of the square, so Montreal, you can see that's the number of participants. So that represents the number of participants. So we have more participants in Montreal than Saskatoon and Vancouver, and approximately the same number in Saskatoon and Vancouver. So we can see here, for example, that in the purple, social media in Montreal was by far the best recruitment strategy, whereas in Saskatoon, advertisements or recruitment through partner organizations was relatively effective. So in the first parts of the study, we recruited via social media, ads on Facebook and Instagram, through partners, through other, which is like in-person events. On Saskatoon, we had staff riding the bus and handing out cards about the study, that kind of stuff. Through traditional media, things like media interviews. And in Montreal and Vancouver, we sent out letters via Canada Post to recruit participants. So this is the baseline for the studies. And we could see here that depending on the city, different methods were more or less effective. You can see Saskatoon has no letters, and you'll see why in a minute. But majority of the participants were recruited via social media, partnerships, and other methods, but this varies quite a lot by city. What does recruitment cost? So this is the second sort of question that we wanted to try to answer. And here is sort of our estimates for the different cities. In general, if you just let's look at letters first. So in general, letters, we were in Montreal, they cost us about $131 per participant recruited. And in Vancouver, they cost about $84 per participant recruited. If we look at social media, these are ads on Facebook and Instagram, somewhere between $13 or $14 and $23 per participant recruited. And you can see the number of participants recruited in the brackets there. So in Montreal, we recruited 503 participants via social media. In Saskatoon, for partners, range between $1 and almost $350 per participant. This is including staff time, so staff attending different events, different community events, those kinds of things. That's the cost there. And other events, in-person events, things like that, quite a big range, somewhere between $18 and $73 per participant recruited for the different participation methods. So we can see here sort of per participant recruited, depending on what city, social media is probably a good investment, but other methods are also important. Of course, a key consideration that you're going to be thinking about is how do we recruit a representative sample of our cities, of our different cities, and what are the characteristics of recruitment methods by demographic characteristics. So I'm not going to show you everything, but I'll show you a few different plots here. So what you see on the x-axis here is what you saw before on the y-axis. So this is the method of recruitment. So letters, social media, letters, traditional media like news articles, other partners, and social media. And on the y-axis, you can see the age category. So 18 to 30, 30 to 49, 50 to 64, and 65 to 88. And we can see here sort of the distribution tends to go. So we're much more able to recruit people 30 to 49 via social media and via other organizations than we are younger people, and the opposite for older people. But interestingly, recruiting younger people seem to work the best through partners. So partner organizations, partner organizations sharing our information, those kinds of things. So that was a critical factor for recruiting older adults. You can see here letters tended to work best for older adults 50 to 64 and 65 to 88. If we look at the same plot via income, stratified by income, we can see here that actually the distribution doesn't really seem to change that much. The lowest income people tended to be recruited most by partners. But after that, it seems sort of relatively similar. Traditional media tended to recruit more people who earned $50,000 to $100,000 per year. But then after that, for the higher income groups, it doesn't really seem to matter which type of recruitment strategy you use. And if we look at education, similar type of distribution here. Letters tended to work better for people who had less than a university degree. And traditional media tended to work better for people who had a university education. But other than that, the distribution seems relatively equal. So high-level summary of our recruitment discussion. So social media is cost-effective. Use it and spend money. So when we were in recruitment periods for the study, we were spending somewhere between $800 and $1,000 per wave, so per recruitment per city on social media advertising. And that was an important way to recruit participants. The recruitment context matters, so you have to have a balance between many recruitment strategies. But we think that still social media is an important strategy, and partnerships matter a lot. Partnerships matter a lot for recruiting specific population groups. There's a question for Matthew. What is the current social media of choice? I'm going to park that, and maybe we can have a chat after, or we'll bring that back. A lot of discussion about this, and I have other context that I can bring in later. So Matthew, if you're okay, I'm going to park that, and we can discuss it later. So that's sort of our summary of social media and costs. So, depending on the method used and the participant group, we were spending somewhere between $15 or $16 per participant on social media to hundreds of dollars per participant on letter recruitment and other types of recruitment. Looking forward, really what we're trying to do, one of our current things we're trying to do with Interact is to provide cities with better ways to recruit representative samples and reduce inequities. So that varies quite a lot per city. I'm in Saskatoon, where we have around 15% of the population who's Indigenous. That's a key target population, or a key equity deserving population for us to recruit in Saskatoon, but also that the city is interested in knowing more about and learning more about. That's different in Montreal, and it's different in Vancouver, and it's different in Victoria. So we really need to consider those populations and how we're able to recruit and retain them in our studies. So the third thing I was going to talk to you about today is physical activity. So how do urban environments influence our physical activity? Cities are really looking for evidence to inform decisions that will have the greatest impact on physical activity. But as I'm sure I'm preaching to the choir, there's things we know, and I think I'd argue there's things we don't know. So we need to understand, one thing we need to understand, I think better, is how urban environments are correlated. And we're just sort of able to do more work in that space recently, and I'll show you some data on that. So through CANU, the Canadian Urban Environmental Health Research Consortium, we're able to look at associations between things like walkability, urban sprawl, gentrification, as well Canadian Mortgage and Housing, along with StatCan, released proximity data. So proximity, dissemination area proximity to things like libraries, primary schools, secondary schools, grocery stores, and so on. So that's critically important for understanding how the built environment overall influences our physical activity. The other thing we need to have a better sense of is where people are. So in Interact, we use high frequency location data. So we combine GPS, global positioning system, and accelerometry data to better understand where people are at any minute of any day. And we need to learn from multiple cities. So lots of the research in this area is focused on bigger cities, places like Montreal or Vancouver, and smaller cities tend to have less published research on them, have a bit less information, places like Saskatoon and Victoria. So we're interested in generalizability. How might things generalize across many different cities of many different sizes? So our questions are, where are people spending time being active? What are these environments like? And how are these environments correlated in space? So to do this, we used the outcome data. So this is daily sum of minutes of sedentary, light, moderate, or vigorous physical activity in each dissemination area. So to do this, we used participants from the Interact study, obviously, who wore a SenStock, which is kind of like a little pager, GPS and accelerometer device for 10 days. We combined those data with the CANAIL, the walkability measure, proximity to amenities from StatCan, urban sprawl, and gentrification. And we included in our models covariates, participant demographics, all those kinds of nice things. So we started with 157 participants in Montreal, 78 in Saskatoon, 150 in Vancouver, and 152 in Victoria. So the people who wore the GPS device are a subset of our big sample who subset of our big sample who agreed to wear our GPS device. Our initial data set had approximately 2.5 million minutes of matched accelerometer and GPS data. And what we did is we calculated the total number of minutes in each day that people spent in a given dissemination area, because we have dissemination, because that's how we can link the GPS data to the environment data. And on average, people spent 19 minutes in a dissemination area in Victoria, 8 minutes in Vancouver, 27 minutes in Saskatoon, and 8 minutes in Montreal, probably because dissemination areas are smaller in bigger cities. The time is less in those bigger cities. What did we find? So what we found was that people spend the most time, tend to spend the most time. The main factor related to people's activity was walkability. So people tend to spend the most, be the most active in the most walkable areas. And you can see sort of what those maps look like in Saskatoon and Montreal, the greater Montreal area. Oops. And in Vancouver and Victoria, you can also see sort of those patterns that we might expect with more walkable areas having more activity. The other thing we found we think is interesting and maybe slightly novel is that a lot of activity was happening close to home, actually in the dissemination area where people lived. So 45% of people's time being active happened in their home dissemination area. So that was something very close to their house. And that's sort of critically important for how we think about physical activity and urban environments and health, I think. Environments that had more physical activity tended to be highly walkable. So for each quintile increase in the CANAIL or the walkability score, active minutes per day increased by 15 to 35%. Again, I'm preaching to the converted here. I think we all know this. But what's interesting to note is that less physical activity, relatively speaking, happened in areas that were highly compact and close to transit. Urban compactness was associated with less physical activity across all 4 cities. So it could be that people are tending to, take a short walk to transit and getting on transit and then being slightly less active. So that's something that we might think about in terms of intervention. And there's some differences. So in Montreal, Vancouver, and Victoria, proximity to public transit was negatively associated with time spent being active. So the more time people spent close to transit, the less active they were. Sorry, I'm just going to have a quick sip of water. Another key thing we were interested in this work was looking at the impact of gentrification on physical activity. So participants spent less time being physically active in low socioeconomic neighborhoods that had not gentrified. So these would be on average, these would be the lowest socioeconomic neighborhoods in the neighborhood. In a city, they're not gentrifying, they're not really changing over time, and people spent less time being active in those neighborhoods. That makes sense. And patterns within gentrified neighborhoods were mixed. In Montreal, adults spent time being physically active in gentrified neighborhoods. In Vancouver, adults spent more time being physically active also in gentrified neighborhoods. So we didn't see those patterns in Saskatoon and in Victoria. Now, when we look at correlations between these neighborhood features and our different environments, we can see here that okay, question. How do you define gentrified? So part of the work that I did, Interact has done and Canoe has done is to develop a gentrification metric called Genuine. And there's a bunch of different methods to classify gentrification. We use the method called DING. And basically what DING takes into account is the average home value over a 10-year period. So change in average home price over a 10-year period and change in the number of people with over a university education moving into a place in a 10-year period. There's a bunch of different ways to define gentrification, but that's the one that we used for this paper. I can speak more to Genuine in a minute, where in Genuine, we calculated 4 different gentrification measures for Canada and go from there. Oh, thanks, Zoe. So we can see here how the different things are correlated. So it's interesting to note that, for example, can ale or walkability is highly correlated with the number of employment locations, the number of pharmacies, the number of healthcare places, and the number of grocery stores. But walkability is not really highly correlated with things like proximity to primary education and secondary education schools. What we also found in this work is that patterns differed between cities. So different cities had sort of different patterns of correlation between the environmental characteristics that exist in those cities. So for example, in Saskatoon, libraries were not very highly correlated with primary education and secondary education, but that was the case in different cities. So this is really important to try to understand sort of what is the fabric of not only specific things that we might be interested in terms of healthy built environments, like walkability, but also the overall fabric of the city, what's related to what in the city, and how do we understand where we might be able to intervene. So in terms of promoting physical activity and our work around this, what we found is that home location matters a lot. So it's critically important that our neighborhoods, our places where people live, can support physical activity. Walkability also mattered a lot. And one of the critical things about this work is that we have multi-city comparative research. So we're able to show both similarities, like walkability, which supported physical activity across all the cities, but also differences, like we showed with gentrification, having different patterns of association with physical activity compared to other places. And having this multi-city work allows us to compare local context to try to understand why, physical activity is happening in one city, in one type of place, like a gentrified area, versus not happening in another place. So looking forward to the work that we're doing with the large-scale GPS and accelerometer data we have, the large-scale population cohorts are opportunities to test the impacts of built environment interventions. So we had the question earlier about, why did you pick these 4 cities? And really, at the end of the day, what we're interested in trying to do is estimate the impacts of these large-scale built environment changes on people's physical activity, people's well-being, and people's social participation. So how are these big investments in transit and cycling infrastructure impacting people's activity? One of the cool things about Interact is that we have one of the largest cohorts of GPS and accelerometer data in the world. So we're pretty sure that we're the largest cohort study that has multiple waves of data collection. That includes both GPS and accelerometer data. So there's a lot of work to do with not only sort of preparing and organizing the data and methodologically speaking, but also in terms of analyzing impacts. And we're deeply embedded with our cities. So we're able to answer city needs and look at opportunities for more multi-city studies. So, if you live in a different city and you're like, I would love to start a cohort study with GPS and accelerometer data, you can come talk to us, and we're very interested to partner with you. Stephanie says, do you have any plans to do any cost-benefit types of analysis? We don't have any plans to do cost-benefit types of analysis at the moment. I'm sure many people may be aware there are tools that exist out there, like the WHO HEAT tool, which is Health Economic Assessment for Active Transportation or something like that. Those are relatively simple tools to use. There's more complicated ones like ITHM, which is the Integrated Transport and Health Impact Measurement tool that's out of Cambridge. So there's a few different tools that could be used to do this type of cost benefit analysis, but we don't have specific plans to do that at the moment. So one more mentee for you today, and then I'm happy to, we have to go back to the social media question, but I'm happy to hear sort of what you learned, what are your reflections about today, and please feel free to pose any questions that you may have in the chat.